Good evening. My teaching session this evening will be on the importance of proper hand hygiene. The purpose is to reiterate the importance of hand hygiene to prevent the spread of infection or disease. The CDC lists reasons how properly washing your hands can prevent the spread of disease and infection. It states people frequently touch their eyes, nose, and mouth without even realizing it. Germs can get into the body through the eyes, the nose, and the mouth and make us sick. Germs from unwashed hands can get into food, drink while people prepare or consume them. Germs can multiply in some types of food or drinks under certain conditions and again make people sick. Germs from unwashed hands can be transferred to objects like handrails, tabletops, and then transferred to another person's hands. Removing germs through hand washing therefore help prevent diarrhea and respiratory infections and may even help prevent skin and eye disease. The CDC also states that hand washing keeps the community healthy. It reduces the number of people who get sick with diarrhea by 31%. Diarrheal illnesses in people with weakened immune systems by 58%. Respiratory illnesses like cold in the general population by 16 to 21%. So, you may ask yourself how to decide on when it's necessary to wash your hands. It should be based on the frequency and intensity of patient contact that you have to determine how you should wash your hands. If you have frequent hand contact with body secretions that potentially could carry bacteria or viruses that may be infectious, that's a way to determine when you should wash your hands. Also, if a patient is susceptible to infection, you should be diligent in washing your hands to prevent spread of disease to that patient. So what is hand hygiene? How is it defined? Hand washing is defined by the CDC as the vigorous, brief rubbing together of all surfaces of lathered hands, followed by rinsing under a stream of water. Hand washing suspends microorganisms and mechanically removes them by rinsing them under water. The fundamental principle of hand hygiene is removal, not killing. So who should perform hand hygiene? Any staff member or person that enters or exits a person's room or patient's room. Any staff member or person that have direct contact with patients and any bodily fluids. Any staff member or person that have contact with medical equipment used by patients. So this list may include, but not limited to, RNs, physicians, housekeeping, radiology, laboratory technicians, CNAs, LPNs, dietary staff members, and family members and visitors. It is crucial that we educate them on proper hand hygiene and when to wash their hands. Teach them that when they enter the room, wash their hands, when they exit the room, to wash their hands. This is not only to protect them, but to protect the patient as well. So how should I wash my hands? Wet your hands with clean running water, warm or cold, and apply soap. Lather your hands by rubbing them together with the soap. Be sure to lather the backs of your hands, between your fingers, and under your nails. Scrub your hands for at least 20 seconds. If you need a timer, hum the happy birthday song twice from the beginning to end. Rinse your hands well under running water and dry your hands using a clean paper towel or air dry them. Okay, so when should I wash my hands? When hands are visibly dirty or contaminated, before eating food, before and after direct patient care, after contact with any bodily fluids or skin, before and after treating a cut or a wound, after using the toilet. I know that's simple, and we teach that as soon as kids are potty trained. Wash your hands, but still it has to be reiterated that after you use the restroom, you should wash your hands. After blowing your nose, coughing, or sneezing, if not visibly dirty, then alcohol-based sanitizer is appropriate. After touching the garbage, if you change your patient's garbage, wash your hands afterwards. Before and after invasive procedures such as Foley insertion. I know that you wear gloves and it's a sterile procedure, but you should wash your hands before and you should wash your hands after that procedure is done. What are some reasons that we do not wash our hands, and what are some solutions to those reasons? Sometimes as nurses and we're overwhelmed and we're running around, we get too busy. And we just don't wash our hands from one item to the next that's on our list. We should always remain patient-centered by providing clean and safe care. We should be conscious about what we're doing and the things that we're touching, and making sure that we're properly hand washing our hands. There's empty sanitizer dispensers. You should go to the nearest next sanitizer dispenser or to the nearest sink and wash your hands. And then you should report empty dispensers immediately to the proper staff. Increased hand hygiene dries out the skin. You should use approved hand lotion to prevent cracked and dry skin. Most units and most floors will provide that lotion for you, so it's important that we use those approved hand lotions, because some lotions are oil-based and they decrease the effectiveness of the gloves that you use that is providing protection. So it's important that we use approved hand lotion. Lack of accountability and monitoring. We should hold each other accountable and remind co-workers respectfully and politely of the importance of hand hygiene. So I hope that I have provided some good information on why it's important to wash our hands, and reiterated the importance again of why to practice good hygiene and protect our patients. So again, I thank you, and I hope that this is a good reminder that we should be doing those things to provide good patient care. Thank you.